Namaskar. Myself, Dr. Umesh Gupta, MBBS MD, working in the field of medicine from past 12 years. I have my own clinic in Chitrakoot, Jaipur. Today I am going to speak about the latest updates on hypertension. As per WHO, nearly 63% of total death in India are due to non-communicable disease, of which 27% are attributed to cardiovascular disease, which affect 45% people in the age group of 40 to 69. Raised blood pressure is among the most important risk factor for cardiovascular disease. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow up. In India, the prevalence has also gone up over the past 30 years from 38% in men and 32% in women. Medication are used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women, which is very less. International Society of Hypertension has released the ISS 2020 Global Hypertension Practice Guideline, in which the inclusion of optimal and essential treatment paradigm attempt to address the issue that in resource poor settings, optimal care refer to evidence-based standard of care, and whereas essential standard refer to minimum standard of care. Acute respiratory distress syndrome is a potentially fatal condition involving lung damage, and experts often associate it with severe COVID-19. Lowering systolic blood pressure targets down to the 110 to less than 130 millimeter mercury range substantially reduced cardiovascular adverse event in the STEP randomized trial, affirming the sprint finding for an older Chinese population. With regards to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European guideline on the management of arterial hypertension recommend that the diagnosis of hypertension should not only be dependent on office blood pressure measurement, but also on out of office measurement, such as ambulatory blood pressure management or home based blood pressure monitoring. 24-hour and nighttime blood pressure measurement are associated with great risk of mortality and a composite of cardiovascular outcome. Thus, they may be considered as the most relevant measurements for estimating cardiovascular risk. For every 20 by 10 millimeter of mercury increment of BP measured at night, the risk of mortality increased by 23% and the risk of cardiovascular events by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal blood pressure control. The 2018 European guideline equally recommend 5 classes of antihypertensive drugs considering high non-adherence treatment. The importance of combination treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, the 2018 European guideline recommend, especially in the context of lower BP targets, to start antihypertensive therapy with an initial dual fixed dose combination of ACE inhibitor or ARB plus CCB, calcium channel blockers or diuretics. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of a known carcinogen, namely N-nitro-dimethylamine, which can be found in candesartan, irbesartan, losartan, olmesartan, and valsartan. NDMA has been classified by the WHO International Agency for Research on Cancer to be carcinogenic in humans. In 1 lakh patient would have received NDMA contaminated valsartan from Zhejiang Huai every day for 6 years in the highest dose. It could result in 22 additional liver cancer over the lifetime of these patients. The presence of NDMA in these drugs could lead to 8 additional cancer cases in 1 lakh patient if they had taken the highest daily dose over 4 years. The HYGEA study represents the largest study that tested nighttime antihypertensive treatment. In this trial, chronotherapy was associated with a significant reduction in endpoints, including death. The HYGEA chronotherapy trial tested whether nighttime therapy, in comparison to usual upon awakening hypertension therapy, exerts a favorable cardiovascular risk reduction. The largest study is, included a total of 19,084 hypertensive patients during an average follow-up of 6.3 years. 1,752 participants experienced the primary cardiovascular outcome. An ambulatory BP measurement was performed for 48 hours to collect data on how BP differed during sleep. RR reduction for cardiovascular events was significantly improved for nighttime treatment when compared with awakening treatment. Thank you.